what we do.
We solve problems.
Okay.
Create impact.
No, not this again. I can't do it anymore. Enough. Why?
Hello, everyone. Welcome, very warm welcome to Macro, the third and last of the graduation showcase events held by the students of the MA Service Design. I'm Cordula Friedlander, Associate Lecturer on this program. It is only fair to say that this year's students were faced with pretty unprecedented challenges and circumstances, starting the course in the midst of the pandemic, when teaching was delivered only partly in person and restricted to social bubbles, to then having to move fully online during lockdown. Beating the odds, this cohort of MA Service Design students demonstrated incredible resilience and creativity, partly when particularly when it came to innovating and exploring tools to recruit participants and co-create within the new constraints. On the MA Service Design, our learning approach is inherently human-centric, with strong emphasis on cultural awareness and ethical considerations, using design methods to visualize and prototype throughout the service design process. Here at LCC, we're particularly proud of our long-standing collaborations with the public sector, enabling the students through live project briefs to engage in societal challenges. These included recently homelessness, resilient aging, or the vacant units on our high streets, just to name a few. Initially working in teams, students develop and apply methods and tools to discover and understand lives as lived, and working with multiple actors in the project context. Existing channels and relationships and the barriers faced by both the service users and the service providers. The learnings and insights are then synthesized to conceptualize and prototype solutions together with the individual stakeholders and the project partners. This approach equips students with skills needed in praxis and also in further design research studies. Today's theme is macro, and the context students have set for today is as followed. Looking at the world increasingly relying on complex systems which alienate and undermine individual and cultural nuances. The theme macro inspires individual actions and collaborations, helping to break away from single stories and build a bridge of communication between different communities. The project in this theme used the lens of awareness, critical coping, participation, and circularity to leverage the power of large systems for the benefit of the public. In this theme, we have 9 projects that will be introduced in detail as the session begins. I would now like to hand over to our brilliant graduates from 2021 and our host of the day and graduating student, Chen Adler. Thank you.
Thank you, Cordula. Welcome, everyone. I'm Chen Adler, and we're glad to have you here today. Thank you for joining us. You can find the house rules in the chat, and if you have any questions for our panelists, you can type them in the Q&A window and we'll address them at the end of the session. I'm going to introduce the MA Service Design graduates of 2021. And in this session, looking through the macro lens, we have 9 participants. We have Yachi, Saili, Musa, Ian, Ran, Dikshita, Gina, Isa, and Idan. They will talk about their process and project outcomes, but let's get to know them first. So Yachi, over to you.
Yeah, thank you, Han. Hi, I'm Yachi. My project is homes. So what if adult children from geographic difficult families have access to social help to better manage and mediate their parents' aging lives?
Hi, I'm Saili, and my project is about empowering teachers to support young carers better in education. And the question it's trying to address is, what if vulnerable young children were supported to achieve their full potential in education? Thanks.
Hi, everybody. I'm Musa, and my service is called Interim. It's a system to guide patients to the right health information while they're waiting for surgical or mental health treatment. And the question that it seeks to answer is basically, what if vulnerable individuals had the critical skills to confidently navigate through the vast landscape of health information? Thank you.
Hi, everybody. I'm Ian. My project is a service for Alzheimer's patient and care. And the question is, what if the family with Alzheimer's disease had better social involvement?
Hi everyone, I'm Ran, and my project JABT is a service that helps users reduce vaccine hesitation and enter the vaccination process more smoothly and confidently. And I try to answer my question is, what if young people are able to make their first decisions about their health with more confidence? Thank you.
Hello, everyone. My name is Dikshita, and my project is called Look At. The focus of my project is about creativity in education, and my research focuses on what if creativity was brought outside of the classrooms.
Hello everyone, I'm Gina. My project is sustainability up. I'm thinking, what if retailers and customers could create sustainability awareness and change behavior together?
Hey everyone, my name is Issa Brooks, and my service Chat with Penny is an accessible and personalized chatbot service that helps young adults. And this explores the question, what if mental health technology was personalized and accessible for everyone?
Nice to meet you all, everyone. I'm Idan Zam. My service is to stop antibiotics-resistant university initiatives. The service focuses on the antibiotics resistance in China. And then my what if question is, what if the networks and initiatives could empower the individuals to make meaningful behavior change using the antibiotics to stop antibiotics resistance?
Okay, thank you, panelists. So next we will understand the context behind these brilliant projects and dive deeper into their projects. So our first question for the panel will be, what motivates you to work on this topic? And Yachi, if you can please share a bit about that.
Thank you, Han. So for my project, as you know, that aging now is a global trend, and obviously China has the largest elderly population in the world. So my project initially considered to help Chinese older people live happily in their aging life. But when the project progressed, many older people experienced that their happiness was closely linked to the happiness of their children. So I gradually turned my attention to adult children in a family. And I found that most adult children moved to another city for better living conditions, and geographic differences weaken communication, companionship, and care within the family. And also they are facing many pressure from outside the family, such as the demand of society on their responsibility that they should care their parents. So, and also at the same time, society put more resources into the elderly people, leaving other children ignored. So that made me think that aging should not be a simple question of the elderly, but also the family, and the children need to be empowered to be more involved in their parents' lives. And that is why I want to do this project. Yeah, thank you.
Thank you, Yachi. This is a very interesting area that you looked into. And let's move on to our next question. So what are the challenges you faced while working on the project? And Dikshita, if you can please share a bit about it.
Yes, thank you, Ken, for your question. Honestly, the project came with a number of challenges, starting from interacting with children to finding parents for user testing. But I would like to highlight upon two main challenges. So I started off with this project with a systems map that helped me navigate through information acquired from desk research and identifying some stakeholders for primary research. Overall, everyone agreed that education requires more creative thinking, and the challenge is to train and cultivate teachers with the right resources. This was the first challenge I encountered because due to summer holidays, I couldn't reach inside schools, and also teachers were stretched to make up with the learning loss due to the pandemic. So a large part of my validations that depended upon them did not happen. And due to the time constraints, I had to switch my lens to parents. And what if creativity was brought outside of the classroom was born? Secondly, the system of education is vast. And while I was doing my desk research, I identified a lot of design opportunities and, there's areas of improvements. So finding that one touch point which would be feasible with the time constraints and also viable from a service perspective became a challenge for me. Because as a designer, I always thought of creating a bigger impact, blindsiding all the tiny windows of opportunities that were right in front of me. So this is when I mapped a day in life of a parent and found one window, which was walking to school. And I asked myself, what can I do as a service designer to bring creativity in those 10 minutes? And that's when I kickstarted my project. Thank you.
Thank you, Dikshita, for sharing that. I'm sure it must have been really challenging, especially engaging parents over summertime.
Yeah.
I'd also like to ask Idan about her challenges during her process.
Yeah, thank you, Han. So the biggest challenge for me of the project is to be flexible to do in and do out. So from the beginning of the project, the aim is to understand the entire ecosystem on crying antibiotics and to understand the reason what caused antibiotics so serious in China. So in exploring the ecosystem, I spent lots of time to understand each branch of the stakeholders map, and it's like endless work. So the good points, you are approaching various truths, but without specific goal, you're probably more likely to expanding the topics instead of digging deeper. So however, narrowing down is not easy work. With insights from various user groups and their networks, it's really easy to get lost. So finally, I combined the comparison user groups and extreme user methods and picked the college students as my final target users. So I also have some code discovery workshops and FS maps with the college students to understand their mindset, preferences, and how they build trust. And the best honest insight to build the behavior models, why they misuse antibiotics. So when I determine the target users, it's time to zoom out again. Besides, antibiotics resistance is a sensitive topics in China. So building trust with the different professionals and the stakeholders is another challenge to start the entire project. So interdisciplinary cooperation is to make the professionals understand my goal and also be willing to share or even cooperate with me. So which is really tricky and it costs a lot of time to achieve that. Yeah, thank you.
Thank you, Idan, for sharing that. And with that, I'll move on to my next question, which is, what were the aha or unique moments through your journey? And Musa, if you can please share your moment with us.
Sure. Thank you, Ken. Thank you for the question. So actually, there were quite a few aha moments, if you were to call them that. But the one that pivoted the direction of my project towards interim was the realization that the problem is in fact not the problem. So to give you a little context, the project, I started off on a very linear path, like almost naively believing that health misinformation is the result of some conniving bad actors and misguided WhatsApp warriors. And I wanted to stem the flow of health misinformation from its source. But as I read more into it, as I spoke to people and understood the reasons for medical skepticism, I realized that there are these decades-old systemic issues that have weakened trust between vulnerable individuals and the healthcare system. For instance, someone being hesitant of going to the GP because of a misdiagnosis in the past, or constant rude behavior from the staff or doctors, which honestly can be dehumanizing. Now, add to this the emerging national health crisis. NHS today has a backlog of over 5 million patients waiting for critical surgery or mental health surgery treatment. And some of these patients have been waiting for up to 2 years, like with little or no information regarding what steps to take while they wait. And if you think about it, it's often in these gaps in service that push individuals to turn to alternate sources of information, some of which might be dubious and harmful to them. So basically helping misinformation. So yeah, thanks.
Thanks, Musa. It's actually really insightful, as this is so relevant in the current times that happening, especially what happened around COVID. So thank you for sharing that. Okay, we'll move on to the next question, which is, what impact does your project aim to create? And I would like to ask Gina if you can please share a bit about that.
Thank you, Han. So my project is about sustainable consumption, and this project is cooperated with Decathlon UK. Decathlon is a global sport retail brand. We focus on innovation, several sustainable products. And during my internship with this organization, I observed how the employee present their sustainable initiative and the way they interact with the customers. I realized that people are aware of environmental protection in their daily life already, but when they enter the retail store, they become the customers, and the idea of sustainable no longer appears in their mind. So the same situation happens with the staff. The staff who express strong agreement with the sustainability in the service. When they are working the store, they are only thought of themselves as a normal laborers to repair the bike or organize the product on the shelf. So no matter the retail brand is promoting their sustainability and developing the material innovations, it's nothing to do with them. And in my research, I found that customers, staff, and retail brands, these three roles have significant change when the conversion of the context, identities, and the space. So my surveys, Sustainability Team Up, aim to change and create identity for stakeholders, assess them to transform from the original selling and buying business relationship into a more socialized, localized connect with sustainable as their core value. So I try to, from bottom to up, to make this service establish a long-term communication channels between the customer, staff, and the brand. It shows the expression of the sustainable consumption in customers' consciousness, making people know that their choice represent their attitudes and feeling being heard by the brands. Thank you.
Thank you, Gina, for that. I would like to ask the same question, Siley, if you can please tell us more a bit from your project.
Thank you, Ken. Thank you for your question. So similar to Gina's, my project also aims to change mindsets and redefine communication between stakeholders, but in a different context. So like you can see here, my service is about empowering teachers to support young carers in education. So before I started my project, the term young carer was unknown to me, as it may be to many of us here. But I found that there are almost 1 million young children in the UK who can be called young carers. So these are people with caring responsibilities for family members who might be ill or disabled. So these responsibilities make them vulnerable and disadvantaged in education, as they not only achieve lower grades and miss out on future employment opportunities, but they're also susceptible to bullying and unfair treatment in schools. And plus the stigma associated with the label, and like there's a general hesitancy around care services. And this means that majority of these young carers do not receive any kind of support. So I realized through my research that it was crucial to support them in their daily lives, especially in schools. And this became my service design opportunity. So in response to that, which is my service outcome care circle, like you can see here on the screen, it's a digital training program which raises awareness and provides training for teachers who about who young carers are and how best to support them within their capabilities. The impact actually care circle aims to create is twofold. Number one, at a personal level, it aims to empower teachers to build better relationships with young carers in their class, helping these young carers feel understood and safe in schools. But essentially, the long-term aim here is to reduce the stigma faced by young carers and create equal opportunities for them, ultimately increasing their chances at a better future. And number two, you would ask what's in it for schools, right? So the aim is to improve the school's outcomes in terms of attendance and attainment, which they can then demonstrate to the regulating authorities, which is Ofsted. But ultimately, the overall goal of this project is to make support of young carers a statutory responsibility for all schools in the UK. And this service, Care Circle, hopes to unite all school staff in influencing that much needed change. Thank you.
Thank you, Saimi. Your project has such a great importance, so thank you for sharing that with us. Let's move on to our next question, which is, how does your project fit in this ecosystem? And Ian, if you could tell us about your project.
My project is aimed at Alzheimer patient and the carrier. They are facing long-term nursing care and stress. And yes, it is no practical way to reverse Alzheimer's, but still have a lot of things I think people can do. Public misconception about Alzheimer's disease, it leads stigmatization, leads people to learn about it. But everyone have a risk to develop the Alzheimer's disease. You better know it earlier. So how to make the earlier diagnosis and make more people aware about Alzheimer's? At the same time, the patient and the carrier have a great motivation to let outside world know about them. And how to use this motivation is something I always want to try to do. And under this theme, I think, I hope the project link more family members, link more patients, and also link the public through sharing memories. And when more people join in and sharing their memories, this keeps the memory going. And that will help the world without the Alzheimer's. Thank you.
Thank you, Anne. Such a very sensitive and important subject, which must have required a lot of sensitivity and empathy. Thank you for sharing that. I would like to ask Isa the same question, as your project also deals with healthcare, but from different perspective. So if you could tell us a bit more.
Yeah, thanks, Hen. Definitely. So my project, Penny, is a chatbot that helps facilitate more accessible mental health resources for young adults. So inherently going into the project, I was aware of the macro lens that I had to take with this project. So I applied a service design tool called system mapping to really understand the various intersectionalities at play. So things from financial investment to discrimination, commitment that you would have to make for time, privacy concerns. And in doing the system mapping, I was able to identify where the gaps were, and then able to use co-design sessions with young adults to create a service that would actually help work for them in the best way possible and to bridge these gaps. So from there, I was able to really raise awareness around the current existing resources that are online, and then the chatbot service would help facilitate that even more. So yeah, through the project, it was definitely key to take a macro lens and identify those various intersectionalities.
Thank you, Isa. So also, if anybody wants to have a look at any of the projects, like Isa, for example, it's mentioned in the chat. So you can click on any of the projects and see it over there. And with that, I would like also to ask Musa the same question.
All right. Thank you once again, Ken. So basically, if you see on the left, there's this big bubble. So what we're trying to kind of say is that, we have the core health services that people ideally rely on, hospitals, GP clinics, A&Es, urgent care. But currently after COVID, they're under this immense stress, which is causing like a new set of operational issues, like primarily the one of abnormally long wait times for surgery, which I'd mentioned earlier. And often after the diagnosis of patients, especially vulnerable patients, they're left in this limbo zone where during this long wait, they're just waiting to receive any reassurance or useful communication from their healthcare provider. What do I do next? How do I manage the pain? And that's a time when they're anxious and like really worried. So what Interim seeks to do, it seeks to kind of scoop them out of this limbo and connect them with these trusted proxies of healthcare, local community leaders, local community groups, local health volunteers, peer groups who are also going through the pain of waiting or going through similar conditions, and pharmacists. These are trusted and accessible individuals or entities who people feel they can turn to for reassurance, for relief even, or for counsel. And eventually, interim would also be incorporated into the service experience with healthcare providers. So patients can be signposted to the service, for instance, maybe on the letter, which informs them about their diagnosis. So if you think about it from a macro perspective, imagine all the services and information available as distant islands, right? What interim does, it forms the bridges and signages to guide people through them or kind of navigate amongst these distant islands. So yeah, that's it.
Thank you, Musa, for sharing that. Okay, I think we'll move on to the next question, which is which phase of the project inspired you the most? And I would like to ask Ren to share with us what inspired her the most.
Okay, thank you, Hen. And for me, I think the expert interviews gave me more inspiration for me. Because my project related to the field of science and health, so which was a big challenge for my background. And it was very necessary and very helpful to always talk to more experts. For example, I used to think that if people were given more correct information, then they would make the right judgment. But when I spoke to a psychologist, I was inspired by his words. He said, you can keep feeding people facts, but that won't necessarily affect their perception, their behavior, or ultimately their decisions. So this made me realize that as a service designer, we should have a deeper insight into user needs and give solutions to that suit different users. So keep that in mind. I tried looking at a solution from different perspectives, not just providing a right information for them, but also thinking about, for example, highlighting the pro-social benefit of vaccination or make vaccination as easy as possible to access. Thank you.
Thank you, Ran. This is so interesting. Thank you. Idan, I would like to ask you the same question. What inspired you the most?
Yeah, thank you, Hen. So the first is between the design and the define design stage. So firstly, the define stage makes me more certain about there are some methods to stop antibiotic resistance from the individual level instead of professional. I read a lot of intervention design and behavior change articles, and also at the same time doing some co-design workshops with the designer professionals. And then I reverse back to move forward with these insights and to understand how the college students and individuals really trust with information and their access of acquiring the antibiotics. Also bring these insights to figure out how to utilize the behavior models to make a behavior change over services. So the co-design workshops with designer, college students, and professionals is another chance for me to inspire a lot to figure out my services. Like, so the co-design participants bring their understanding, knowledge, and the experience to try to intervene the persona to stop antibiotics or severe medication behaviors with antibiotics. So this workshop helps me to figure out how to connect with different stakeholders to provide knowledge and interventions. So my service is applied to the providing a platform trying to help students to gain enough information on using antibiotics and then to trigger meaningful behavior change. The behavior change happens in silence. The public is changing with knowledge and the proper barriers and interventions. So in my point of view, especially from the inspired from the co-designs, it's essential to make individuals understand why they need to change. Maybe just more conversation like, is antibiotics really necessary or do I have other choice? Situation would be different. And also building trust is another important thing to make this change. So my service we are using this to points to help students to make more engaged with topics of antibiotics resistance and topics of the health and building trust with this access and information. So inspiration for me always happens to exploring something new and reviewing the current insights. Maybe it's also be connected with one missing stakeholders or the values just realized. Yeah, thank you.
Thank you, Dan. I think it demonstrates the importance of engaging with your stakeholders to develop this understanding. And how important it is. So thank you. And Ian, if you can please share your what inspired you the most?
Yeah. The most inspiring phase in the project for me is I worked as a volunteer with many families of patients to raise money for Alzheimer's. It is a cold day and a raining, actually very bad day actually, but everyone was finished their activities and very happy. I feel passion, I feel love, and I got to know very basic things. People are willing to support the people they loved, which is probably the greatest strength in the plants. I think we should nurture it. So the project helped the patient family by assisting them with the activities and helping them to present their story to wide audience through museum and apps. And over this project, I constantly want to define what is the good care for people with Alzheimer's. I think the truest human emotion can always inspire you. Yeah, that's it. Thank you.
Thank you, and that was beautiful and very insightful. And we'll move on to the next question, which is, what are the key values of your project? And I would like to ask Ran to answer that.
Thank you for the question. I think for my project, I have long-term and short-term values in my project. For the short term, I think the value is that as vaccine information and service hub for young people living in the UK become aware of vaccines, protect us from harm and receiving a proper vaccine. My service can help people reduce vaccine hesitation and enter the vaccination process more smoothly and confidently. And for the long-term value, all of studies and interviews showed a lack of understanding about immunizations and healthcare practices. But even though COVID have transformed our world a lot, we should say it has also provided opportunity to learn and grow. Diseases are not going away anytime soon, so I hope my service can provide students with the knowledge they need to success in school and stay safe as adults, and then they can pass this type of knowledge about vaccine into the future generations. Thank you.
Thank you, Ran. And for the audience, if you want to learn more about Ran's project, you can look for her link and you'll find some more details there. Thank you. Let's move to our next question. Sorry, it's not the next question, it's Dikshita. And Dikshita, if you can please tell us about your key values of this project.
Thank you, Ken, for your question. So Look At is a service to inspire imaginative inquiry while walking the young to school. It's built on a very simple vision of taking joy in walking and observing the surrounding whilst building upon some creative behaviors. The aim was to provide an opportunity to parents and teachers to explore new ways of engaging with children and also lower the walls between the school and the world outside. So in pursuit of achieving this, I focused on parents by equipping them with resources to nurture a creative mindset in young children outside of the classroom through activities of watching and mapping, as you can see in the pictures, resulting in some creative behaviors of imagination, curiosity through expressing and narrating one's experience and building upon their communication skills. So the values of the service lies in strengthening the parent-child relationship, supporting teachers in their field studies, building upon your environmental literacies for children, and as simple as starting to observe things around you, which I feel we've stopped to do because of our phones or a lot of other things. So these are the core values for my project.
Thank you, Dikshita. As you said, I think your image reflects beautifully the values that you were mentioning. Thank you. Now we'll move to our next question, which is, how would you measure your success? And we have Gina to answer that.
Thank you, Hen. Thank you for the question. So success is a very strong word to me because it sounds like a perfect ending. But as a designer, we all know that design never has an end. I would like to share a moment when a thought I see it appear in my mind. My project focused on promoting sustainable consumption behavior by triggering a dialogue between the customer and retail staff. In my previous research, when I interviewed the in-store customers' perception of sustainability, they gave me very ambiguous answers, even told me that they think Decathlon is doing well enough. For a retail brand, they have no more requirements and expectation. However, when I come to the design phase of my project and brought my prototype and as a physical touch points, as you could see in the slide, the shopping basket labeled with sustainable tint identity and the customer feedback received to the customers. And suddenly it was like to connect the dots in their minds. The customers start to describe their expectation for the retailers to me, and even share with me their ideas on how brands can be more friendly and efficient in connect with local communities. The key element I evaluate this success of the survey is how those touchpoints have enhanced people's curiosities, expectation, and participate about sustainability during their normal shopping journey. Whether it is a positive feedback or negative questioning me, when people start to discuss and share their thoughts, the idea of sustainable consumption has already entered their mind, just like to put the seeds in their mind and to make it sense in the future. Thank you, Han.
Thank you, Gina, for your answer. And we'll move on to our next question, which is, who are your stakeholders and what role do they play in your project? And Saili, if you can please tell us about that.
Yeah. Thanks, Ken, for your question. So since my project spanned across two sectors, which is social care and education, I engaged with multiple stakeholders across the UK. So essentially my stakeholders are national charities like the Children's Society, who became my potential service providers, and several local young carer services, school safeguarding leads and young carer leads, who are the enablers of the service in school locally, and teachers, who are the primary users of the service. And finally, young carers, who are the main beneficiaries of my service. So national charities like the Children's Society have existing initiatives for schools, which could be leveraged to establish the service, which is Care Circle, in the current system. So the purpose of making the charity the primary provider of the service was to adopt a UK-wide and consistent approach. So as you can see on the map, the role of the charity would be to keep the service, the digital training program, updated and evolving, and also ensure that it reaches as many schools as possible. Since the service, like you can see, originates outside of the system, the education system, stakeholders like young carer services or designated young carer leads in schools would raise awareness and introduce the service and get school staff and leadership on board. The teachers would then undergo the training, develop confidence through best practice examples, and gain accreditations for completing the training. And finally, like the young carers, who are the beneficiaries of the service, would receive the continuous understanding and support that they need from their teachers. Since the service sits outside of the education system here, in the future, it has to find its way into the education system to ensure maximum uptake. So for that to happen, I identified stakeholders like continuous professional development providers, local safeguarding boards, and initial teacher education providers, who will suitably then adopt this service and deliver the service in various schools. So overall, it was a complex project, and the service involved like multiple engagement of multiple stakeholders across physical and digital channels. But at every step, it kind of reinforced how service design can bring together people and organizations across the country for the benefit of the disadvantaged communities. Thank you.
Thank you, Saili. I think, yeah, looking at your project, it is so exciting to see how the stakeholders all unite around that. Thank you for that. And okay, we are heading to our last question for this part of the event. And what were the most important insights you found? And I would like to ask Isa to answer this question.
Thanks, Hen. This is such a great question and also a hard one to answer because I learned so much throughout the course of my project. But if I had to kind of boil it down to one insight, over the course of my project, I focused specifically on young adults that suffer from low levels of depression and anxiety. Just knowing that the mental health conditions and concerns are so broad, I kind of wanted to narrow my scope and help young adults in that way. So in talking to young adults who were dealing with this, and also on the other side, from like the mental health professional point of view, I learned that there were so many resources that already existed in the healthcare system, specifically in the UK. But there was a high level of hesitation and inaction. So if someone were to browse their symptoms online, it would lead them to the NHS website and they would read a little bit about it, but there was basically no step taken after reading that information, which then causes, a delay in actually receiving care and signing up for care, which we know already has long wait times. So my service was then pointed in this direction of how can I bridge that gap and actually make a service that will help facilitate and streamline that information that already exists. So a chatbot popped up in my mind as something that can live and personalize that experience and really act as like that one-to-one relationship with the user browsing their symptoms online. And then they can use that information learned from Penny, the chatbot, and then actually take actionable steps towards improving their mental health. So yeah, that was definitely a key insight, and something I was really surprised and glad that I found out along the design journey.
Thank you, Isa. I think it shows how in service design, you don't always have to invent something new, but having this understanding of what you can make better, like how can you improve the existing. Thank you for that. And okay, so last but not least, we have Yachi to answer the same question. So what were the most important insights for you, Yachi?
Thank you, Han. Actually, I feel I have the same feeling with Isa that it's a hard question, and I learned a lot from my project. But I feel like the most important insight that because after my research, I feel like I need to know why adult children have hardly difficulty accessing social help for family programs. And I found that two deep reasons, trust and touch point. So through a bunch of co-design workshop, the committee as a representative of the government was trusted by most people, especially after COVID. This is a first thing that I found. So I think that there is a great potential for community to provide relevant service for families. However, when I dig deeper, that the second is that residents mostly do not see community work. They feel like they can, community don't provide anything for them. So because there is not a stable and quickly way to communicate with residents, as most communities are still using door-to-door visits and telephone calls, which are perceived as a nonsense by residents. So I think in this service, community needs a new way and a first touch point to connect with the family. So from this insight guide me to doing my prototyping and testing, as I need to think about what kind of touch point could trigger the families. And finally, I took inspired from Chinese University establishment letters and using congratulatory letter to establish initial contact. This is the most important insight that I have got. Yeah, thank you.
Thank you, Yachi. That sounds really interesting, especially because it happens in China, which is like different context of what we, especially like me, for example, knows. So thank you for that. And I think we'll move on to our Q&A session. And thanks again for all the panelists for sharing their work with us. And we will now open the stage for questions from the audience. So everyone, please feel free to post your questions in the Q&A window. And don't forget to include the name of the panelist you aim the question for, or you can open it to everyone. Yeah, so let's see, what do we have? So I have a question for Isa. Why did you decide to focus on young adults as your target user group? Could Penny help people in other age groups as well?
Yeah, thank you for the question. It's a great one. So I focused on young adults for this project because through my research and understanding mental health accessibility, I learned that 75% of people experience their first mental health concern, symptom, issue, whatever you want to call it, by age 24. So my service is kind of acting as this preventative measure to kind of intercept and facilitate better conversation around mental health, and really capture an audience that is extremely vulnerable. And if you also think about the age group, so between 18 to 24 years old, you're in this massive life transition where you're kind of thrown out on your own independent vices and having to navigate that space. So I saw that as an opportunity for my service to really help young people.
Thank you, Isa. We have another question for Musa from James, which says, question for Musa. Any tips for understanding the user better when there are research restrictions, such as not being able to currently hold workshops because we need to keep social distancing?
Right. Thanks for your question, James. I think as far as restrictions are concerned, I think currently we've gotten so used to just working within constraints. It's almost become part of life to say that, okay, there's a constraint, let me first figure out how to kind of navigate that. So I think one of the things that we did is we kind of opened up the possibility of communication happening from any possible channel. That means if it's going to happen through phone conversation, that's all right. If it's going to happen through a Zoom call like we're doing today, that's all right. If we're going to be able to do that conversation in a park, in an open space where there's less chance of, or less worry of kind of contracting any severe infection, yes. So I'm saying take all these things into consideration, and that's what I also did. Also, apart from that, irrespective of whether there are restrictions from a perspective of, let's say, a lockdown or something, there could also be restrictions from the user's perspective, or there could be hesitations from a user that they don't necessarily want to appear on a camera, or they might not necessarily be very comfortable revealing their identity. So in that sense, you might need to kind of consider things like chats, like online text-based chat, or telephone chats and stuff like that. Those are usually good ways to work around all these restrictions that will be there. So yeah, I hope that answers your question.
Thank you, Musa. And move on, we have a question for Siley. Who would be the enabling stakeholder to make this service happen?
Yeah. So thanks for your question. So like I mentioned in my stakeholder answers, that this service originates outside of the system in the care sector, in the third sector, in the voluntary sector. So basically, since the service is being provided by national charities have local young carer services across the country. That could either be independent charities, or they could also be local authority commissioned. So these independent local charities actually work closely with schools to develop partnerships where they go in and talk about who the young carers are. They raise awareness, and they try to provide training to teachers. But the way they do this is they develop their own individual kind of resources and duplicate a lot of effort. But if they were to kind of take this service as a resource and go into schools and pitch that to them, saying that this is something that you could do, and then also support the young carers better in your school. So that was one of the enablers. But also some schools are kind of pioneering this whole young carer support, where they have individual young carer leads taking on the responsibility of supporting young carers. So these could also be potential enablers, where they get on like a staff meeting and also tell the staff about this training program that they need to do, and so that they can do that in their own time in CPD hours, so that they can gain those accreditations. And also one thing I would like to mention is that since this is being provided by a national charity, which already has like an awards program. So for example, if in a school, say 10 teachers were to do the service and do the training program, that would count towards an award system. So they're kind of being incentivized to get trained, and then making sure that more and more teachers are kind of aware of how to support young carers. So thank you.
Thank you, Siley. And we have a question for everyone from Katrina. So many of you have projects on quite sensitive issues like Alzheimer's disease or mental health. So what would you recommend to people who design services for such delicate topics? And who would like to take that? Maybe Ian? Yes.
Yeah. I think some topics are very sensitive, and as my project Alzheimer is also very sensitive project. I feel very nervous about it, and I'm very careful to when I interview some people, I like they pretty much don't want to hearing any negative things about disease, about some words, and and also I think the very important thing is sometimes you yourself have a misconception in this, like people think the Alzheimer patient can do anything because they are mentally unstable, and which is actually is not, and that will appear to you doing the project, doing the interview, doing a lot of things. Actually, you need to correct your thoughts, your thinking first, and the most important thing I think is the empathy to understand people in what is their situation is. Yeah, that is very important things. Yeah.
Thank you, Rin. Is there anyone else want to take this question?
I can just add on to what Ian said. So he mentioned empathy, which is extremely important for a service designer to take into any delicate topic. But I also think understanding your role as a service designer, in my case of discussing and researching mental health, I myself am not a mental health professional. It was very important that I make that clear. When I was running co-design sessions with young adults and just acting more as like a facilitator of conversations. So really approaching a project with that lens of, you only know so much in a short period of time. So just to, act with empathy and understanding for all parties involved.
Thank you, Isa. Maybe Idan? Yes.
Yeah, I also like to ask this question because antibiotic resistance is also a sensitive topic in China. So when I'm doing the research, I was firstly want to figure out how the system, also the clinical system, would influence the antibiotics resistance. And I find that these areas probably not that could be involved, or there are not opportunities that can be involved. So I reverse my opinions. Maybe the public is also a good point to have more services to help them to understand antibiotics, also reduce antibiotics resistance. So I think for designers, maybe when you think the direct problems of this direct point to solve this problem, maybe you can reverse your point. Maybe you can find other point to solve these problems, and it's also effective to help the situation. Thank you.
Can I also just quickly add to just whatever everyone's covered, Ian, Isa, and Nidan? One quick thing, when I worked with young carers, actually, like empathy, everything else was obviously a consideration in the sensitive topic, but because I had done my secondary research before, there were a lot of stereotypes in terms of what young carers do. So, they might be caring for a parent who is ill, but there can be various possibilities. Some people might be caring for multiple people. So going into my secondary research, my primary research and my co-design workshops, I had to bear in mind that everyone's story is unique, and then I should not bring in any kind of biases and stereotypes from what I've read before and try to or make a judgment on what they might be doing. So it was always going in with an open mind and just listening to what they have to say and what story they have to tell and about the situation they are in. Thank you.
Thank you, Saile. There's other questions, so let's move on to a question for Dikshita. Nurturing young minds is a good initiative. I would like to understand from Dikshita as to what is the future she's envisages for her service.
Yeah, thank you for the question. Yeah, this was the most tricky part about, okay, what is the future of the service? So yeah, thinking about that, it actually took me like a few days to understand that. But at this moment, my service is restricted to a physical booklet, just to introduce an idea about how do you do mapping, how do you start reflecting upon your experiences, and it's on a weekly basis at the moment. But the service can expand and accommodate a digital touch point by collaborating with mapping associations like DigiMap. So that was one of the associations I wanted to collaborate with. And also by denoting some safe and scenic routes and motivating families to walk and start experiencing the surroundings. In future, I would like to open doors to a pedagogical approach that allows aspects of creative, functional, and curious, especially build upon environmental literacies for children. And this will happen with support of schools and teachers. So on a higher level, this is what I feel that this service can expand into.
Thank you, Dikshita. We have another question for Yachi. So Yachi, if you can please answer that. So do you think your service can be available in other countries, and what are the next steps?
Yeah, thank you. Thank you for the question. Actually, I think most of the service, this service is available to another country. Through the reminder learning and process, most family are empowered to deal with family issue by themselves and build resilience. But I think for the first touch point, because I used more culturally appropriate method for China, so it means that that if use this service to another country, we need to adapt a strategy to connect with the community in the for the different cultural backgrounds. And another question is for the next step, right? Actually, now I have discussed with the service with the local community, and they're really interested in the point of building a connection with the residents, that they will facilitate their other work better, because for them it seems that build a connection is the most useful way for them to do other things. Yeah, so after that, maybe there were a more in-deep collaboration with community to help them better deliver their service and resources to residents. That is the next step I will do.
Thank you, Yachi. And we have a question for Ran. So Ran, could you tell us a bit more about why could you tell us a bit more about why you identified students as your primary users? Who acts as your service enabler?
Thank you for the question. And I should say that firstly, I didn't define directly to the student population is my users first. And I start interviews many minority groups like Asian, Black people who live in London. But finally, I found out there is many different reasons about why they don't believe vaccine, like information misunderstanding, like government transfer information from different countries. Also, like the people, they are like born in the anti-vaxxer family. So for myself, I think this type of question is, I can't really understanding as a foreigner who study in UK. No, as international students who study UK, I can really understanding deeper about those various of reasons. So I think focus on the students is more easily to building empathy and building trust to them, and also it's easy to interview of them. And also for myself, I'm a person who are kind of hesitate about vaccine, because before I come to UK, I know Pfizer, there's lots of side effects, but our country vaccine is much better from our media. So I think it's quite interesting to understand people who just arrived UK, they bring their old knowledge to there, and then they get new knowledge about all type of vaccine, how they think about that. And so for my, sorry for the survey. Okay, So I think the student surveys and NHS and also maybe other business vaccine company like Pfizer and Booth who provide vaccine to others is all my survey support. Yeah, that's it. Hope I can understand the question.
Thank you, Ren. We'll move on with a question for Gina. So if Gina, could your project extend beyond Decathlon and apply to other retailers? What would need to change for this to happen?
Thank you, Hen, and also thank you for this question. When I do the research, this question always in my mind because we don't just want to develop the strategy for Decathlon, but also to see what the general retail could do. And to be honest, when I do the research, I research with a different retailer as a case study as well. And we found out to trigger the diagram will be the start point for every brand. When the customers and their staff knowing their core value of the brand, they could start to move on to the future engagement. So in my design, I'm thinking for the future strategy will be to let the customer staff, the brand staff, and also the local community co-create together. Because as in the context of London, we found out that we have a strong connection with their communities, not only just for the retail brand, the global retail brands in the high street, but also how to cooperate with the others local shops and the charity together will be a core issue as these topics. Because sustainability was not a short-term problem that we need to face, but a long-term strategy that we could develop together. And I would say, if we want to bring the other context to apply to the other retail brand, for example, like a Muji or the North Face or the other sport brand as well. The first thing is need to know what's the attitude from the organization employees, what's the way they want to engage with the customers, and what the resources they have in the physical space and also the online platform. Because my surveys want to make these circulars not only to make these diagrams and interaction happens in their physical store, but also happens in the digital world, and to connect what they have access. For example, like their membership system, while they could bring all their sustainable initiative and service together and make it circulars, and that's the store have a very popular training to know what the brand want to develop. Thank you.
Thank you, Gina, for your answer. We have a question for Siley. What prompted you to focus on school staff as your primary users than the young carriers who are benefiting from the service?
Yeah, thank you for your question. So in my discovery, I found discovery sessions with the young carers, my workshops, I found out 2 key insights from them, which was that they first wanted to know who the other young carers in their class are so that they don't feel very alone in this and ashamed about it. But they, the second is that they wanted to, they also wanted more support from their teachers at school. So my first thought, and which was the most shiny thought, was about creating a platform for young carers in schools to connect with each other. But in speaking to more stakeholders, I found that the teacher-young carer connection was a prevailing pain point for not just young carers, but also for teachers who felt that they were not confident enough to support the young carers. And further, the problem of getting young carers together to connect with each other was already kind of being addressed to an extent by the carer services. And also one thing that stood out was that multiple young carers did not want to be seen through the lens of being a young carer. And thus the solution would not have catered to them. And the point was to actually cater to the young carers who are also hidden. So in fact, then I realized that this was not actually solving a problem at its root, but it was only giving them a way to cope with the existing problems. So this is what like kind of prompted me to mainly focus on teachers as my users instead of young carers themselves, because this was then solving pain points for multiple stakeholders at different levels and kind of paving the way for a better integrated support for the young carers. Thank you.
Thank you, Siley. And it actually leads me to my next question. That is for everyone. Many of these projects talk about very technical topics like antibiotics, vaccines, mental health that are deeply connected to health. How did you build trust into your service for users to trust you as a source of information? Siley, maybe if you can elaborate a bit more, because you worked with such a unique stakeholder
Yeah.
group.
So actually building trust was quite a challenge. So I can give an example of my code discovery sessions with the young carers. So my first session, I was able to engage with around 10, a group of 10 young carers. So going into that session, they had no idea who I was and I had no idea who they were. And I had to take support of a co-facilitator who was a social worker who knew these young carers better. So I had to go in with that, and I had a script planned of what I'm going to say to them and how I'm going to get them to talk to me. But obviously that did not work. So I had to go in the first session. I spent about 6 hours with them in the day, and they already had some session activities planned. So I went in, I sat with them, I observed them, I made sure my face is familiar to them. I had lunch with them. I had started to talk to them about what they do, something beside their caring role. Then I got the chance to play games with them. So this is a different situation, but I had to kind of make them very familiar with me, tell them that I'm friendly and they can approach me. And then finally, towards the end of the day, I then did my discovery session with them. By the time that they had already gotten familiar with me, they were kind of used to talking to me. So that's how I started to build trust. But at the same time, I had to get support from the social worker because I could not dig into their life stories as a stranger. It was the social worker who had to do that. So yeah, that's me. Thank you.
Thank you. This is so interesting. Musa?
Yeah, if I can just add to that. So obviously trust was paramount, especially when you're dealing with healthcare. I think like it mentioned in the question. I think one of the key things that I learned, and especially this was something that came from Southern Council right in my initial research, where they said that the council itself has changed their way of working, wherein now they work directly with people who they don't kind of go to the end user themselves, but they actually route whatever they need to do through these trusted individuals in society. Right. So that's what I also did for my project. Right. So basically going through anybody who already has a position of trust in the community, who already has a position of trust in society. These are people who have trust because of their place in culture, because of their place in maybe the person's life. It could be because of the way they're placed in community, for all these different reasons, or the service that they provide, like a pharmacy, for instance. It could also be on the basis of how accessible they are. For instance, pharmacies are available almost throughout the week. In fact, even GP clinics are only available for certain periods of time, whereas a pharmacy is open throughout the day. So these aspects kind of played a major role in terms of building, in terms of kind of building trust, wherein you're going through the people who are already trusted or the entities that are already trusted. So like Sally also mentioned that she went through a facilitator who really helped to kind of bring things forward. Yeah. So yeah.
Thank you, Musa. Anyone else would like to share? Or we'll move to the next question, which is for Dikshita. So what was both the highlight as well as the most challenging aspect of working with children?
There were a lot of highlights. So when I started off with this project, I got an opportunity to volunteer with this after-school club called Design Club, where we mentored, we taught design thinking to really young children. And that was so interesting because none of them knew what an app was. And in every session, we made sure that we taught one creative behavior. So for example, one session was about storytelling, the other session was about empathy. And there are a few examples that I could give. So like there was this one boy who got a challenge about making someone eat less meat, and he built an app wherein he said that, okay, I'm going to send vegetables to people, but they're going to order meat, so I'm going to trick them into eating vegetables. And that actually got me thinking. I was like, oh my god, how do they make these connections? How do they come up with such ideas? There was this other girl who created an app, and it was about learning a music instrument, and she actually connected that she built a feature which was connected to her own life because she was using an app, but after a few notes she had to pay extra, and she said my parents didn't pay extra, so for my app I'm going to make the budgets a little lower. So these were some little touch points that I realized that children actually reflect upon their own experiences and then design some things. And also they made things so visual. When it came to writing things down or coming up with words, that was when they struggled. But when we said, okay, now you need to start designing because you're a designer, they just start to come pick some crayons and started making things up. So that was the highlight, but the challenge was obviously engaging them. So I was just one person with 5 children around me on one table, but to get everyone's focus at the same time was a challenge for me, because obviously someone is shy, someone is hyper, someone is talkative, someone isn't. So engaging with everyone and making them sit on one table was a challenge. And that's when I realized that how does a teacher do it in a classroom of 30, because I couldn't even manage 5. So that was my challenge, I would say. But overall, it was a wonderful experience.
It sounds like you had great fun there.
Yeah.
Fantastic. I have a question for Isa. With the emerge of more and more digital healthcare services, when you were doing research for your project, did you come across any companies or projects that Penny could be integrated with to help increase accessibility and personalization in the UK mental health care network?
Definitely. Thanks for that question. So it's important to note that Penny, this chatbot, is powered by the resources, trusted resources from the NHS, the BACP, which is the British Association for Counselling and Psychotherapy, the Mental Health Foundation in the UK, and that's alongside the NHS. So within that, it's integrated into those networks. But I also envision Penny living beyond those networks in the future. So it could be living on various charity network pages like Mind UK. That's a great resource if you want to understand symptoms, types of therapy available. So I see that living on websites like that. And then eventually, it would be fantastic if it lived on social media, where young adults are obviously spending a lot of time and are already going to for resources. So on Instagram and TikTok and even YouTube, there's tons of resources on how to improve mental health from trusted therapists and professionals around the world. So building Penny into that would just further the accessibility there. So I definitely have envisioned it living beyond the NHS or its own site.
Thank you, Isa. I have another question for everyone. Is there anything you would change about your projects if you had another 6 months to work on them?
I could answer that. Like I mentioned before, my project managed to engage stakeholders from across the UK. But these stakeholders surprisingly mostly belong to smaller towns and not cities. So because there's more abundance of specialized young carer services and projects in the care sector in towns as compared to larger cities like London. So if given a chance, actually, I would go back to my discovery phase and I would diversify it a little bit and engage stakeholders from larger cities too. And I think this would help me understand the differences in the social care and education system between various geographical areas, because they can be vastly different depending on where you're located, and also make the design process more inclusive. And also one more thing is that young carers belonging to minority communities especially are more likely to be hidden from care services. And like we all know, cities are home to a larger number of minority communities and immigrants. So if I could do this, diversify and do it differently, I would be also able to equally represent the voices of these hidden young carers across communities. But I think one way I try to mitigate that is that I made sure to create a service outcome that does not put these young carers in a box or label them. That would benefit all young carers regardless of their background or whether they're hidden or not, or whatever the community they come from, whatever region they come from. So yeah, that's the way I would do it differently. Thank you.
I will also want to take this question as well. So because different languages will become different design strategy when we to do our research. And I found if I know I could do this my whole project with 1 year because I have more 6 months, then I probably will go back to my define stage to see how's my archetype to develop in a different type. Because as a decano, they have more focused customers, they have their target group. But I also found out about sustainability, this issue were to more generally from the young generation to have a more impact to their parents or the people surround them. And I wouldn't just focus on how's the interact with the staff and the customer, but also have a more chance to see how's the details about the customer's type and to how's the in the family's members, how do they engage with the different roles in their family and co-create and cooperate with the retail brands, how to bring these ideas and awareness into the family life.
Yeah, I could also add in a little more. So if I would have gotten 6 months more, I think I would focus on the testing bit, because I did a bit of testing and I made I got a few maps in response to when I sent out the service to a lot of parents, and I realized that children have their own way of representing their journeys. There were some children who drew like helicopters, and I was like, where did you even see a helicopter, like a big helicopter on a map? There were some children who started drawing birds. So if I would have had more time, I would like to like sit and understand what could you do with this data and how could you use this data, and maybe associations like the GMAPs or maybe council could use this data to make changes in the surroundings of how children see their area. So if I would have had more time, I would, I think, focus more on the testing and then understand what you could do with this data.
Thank you, Dikshita. We'll move on for a question for Idan. It's anonymous, but someone says, I hadn't been concerned about the impact of antibiotics before. Your project has made me think a lot. What do you see as the future impact of your project?
Thank you for the questions. So basically the service overall is provided by internet hospitals, and which combine the online medical services with intervention and offline education services. So this project will help the healthcare department in the future, who is expecting to provide more services and medical services online, which will help them to improve their antibiotics management online and offline. Also, the service could also work in the physical systems while connecting the primary healthcare and the primary medical facilities with the internet healthcare systems. So my service have 2 parts. So the first one is to access networks, which are intervention systems like drug replacement, prescription analysis prompt, and the conversation with doctors. So when this prompt and interventions, the simple intervention on the support chest and after taking process, the consumer will be more aware about the antibiotics resistance and start to make a difference. And also the company will have some competitive features, like they have a big data about the replacement and the prescriptions and the people's feedbacks to improve the services. And also I have another part is the information networks, which is create the multiple channels, educating users by organizing workshops or establishing information sharing platforms and the pharmacy services. So the goal is making the primary healthcare system and the information source have a very close link. So they can be applied in the multiple scenarios, like to apply it in the community, district, and village or rural areas. So the individuals can be more aware about antibiotics and have more information about these correct informations and reshape their irrational drug use and the behaviors through this information and education. Thank you.
Thank you, Idan. I have a last question for everyone. How do you know that the insights you find at the define stage are actually true for the majority of the population? And how many interviews do you suggest would work to define this?
I think I can try to answer this question. For me, I think the key to being confident in my finding is have a multiply or many different research methods to validate your insights, which often means a mix of qualitative and quantitative results. So in my opinion, it's good to practice to use 3 research methods in the discovery stage to add extra validate to your finding. So generally, I think the research methods will use to definitely base it on how many users or how many clients in my services. But personally, for one-to-one interviews, I like to have between 6 or 10 people or a couple from different personas or user groups I've identified. So then I can further validate to my finding with additional data or focus group or workshop and so on. Yeah.
Thank you, Ran. Anyone else would like to take this question? Maybe Achi?
Okay, actually, because this is a really hard question for me because actually, because I have a really long quarantine while back China, so all the things I have done is on the internet. So actually, what I done is that first I got a lot of data from different websites, like from the government, from the community, to make sure that this group of people have this question. This is the first thing. And another thing is that I read a bunch of, essays that talk about the family issues, about aging lives, some of the question, some of these articles. So make sure that this program is already researched by a lot of other people, and there are at least some outcomes or some insights that other people got. So this helped me to test my prototype, my persona, or the insights that I have got. So this is the main way that I have used, because it's a really long quarantine and I can't do anything offline. Yeah. And actually, for the next question is how many interviews do I suggest? Actually, I feel like testing or to measure the idea, your insights, and never-ending things. So it's really hard to say how many, but mostly I feel like 6 or 8 people will most to know the basic question, and you should to deeper that another question and to find the most of the people want to do. Yeah, this is things I suggest.
Thank you, Achi. Okay, so I think we have great answers here. And let's give a big round of applause for our graduates for their fantastic work. So thank you. And today was our last session. So thank you everyone for attending and being part of the events. I hope it was insightful for you. Be sure to check the graduates projects. You can find again the links in the chat to get more detailed understanding of what they did. You'll find all the 32 projects there as well. And if Sylvia or Cordula would like to say few words to end with.
Yes, I'm here, sorry. Yes, thank you everyone for sharing your projects, and we know how, all the excitement that goes along with this, and very well rehearsed as well. So, and thank you for all the alumni that we could see on the attendee list, and anyone who joined this event, and for your questions that you asked. And please, yes, do check out the projects and keep in touch with the MA Service Design. Thank you.
Thank you, Hen. Thanks for today's hosting.
Thank
Yeah,
you.
thank you so much.
Bye-bye.
Thank you, Ham.
Bye.
Yeah.
Thank you,
Thanks, Ken.
everyone.
Thanks, Vinny.
I was on
Thanks,
mute.
Dina.
Bye.
Thank you all.
Bye.
Bye.